Every year at September, many of us in the academic community are excited to think about the beginning of a new year, a year where we'll think about new students, where we'll think about starting of the school year, and we'll think about the latest stage of our research projects. It's also a wonderful time of year to think about what are some of the most impactful new scientific findings emerging in the fields of clinical neuroscience, psychology, and psychiatry. Most research using brain imaging to study mental disorders primarily contrasts one mental disorder from another mental disorder using DSM-based classifications. Chand and colleagues report important new findings that differentiate among a group of patients who all share the same diagnosis, that is, the diagnosis of a psychotic disorder. The important new insights to emerge from this study suggest that there might be subtypes of psychotic disorders that are characterized by unique profiles from a brain structural standpoint. And this is going to increase interest in thinking about what are some of the other factors that differentiate among patients within a single diagnostic category. How can we use understandings of biology to try to relate insights on clinical differences among patients, again, all of whom share a similar diagnosis, such as a psychotic disorder, in this important new study? To a certain extent, we've known for many years that the clinical features related to diagnosis are important predictors in terms of a patient's long-term outcome. Gregersen and colleagues add to this literature by examining outcomes among a group of patients at familial risk for bipolar disorder, a psychotic disorder, or various combinations of these two syndromes. The important findings to emerge from this study call attention not necessarily to the diagnostic classification of an individual patient, but the presence of psychosis, regardless of the category in which a patient might exist in terms of their clinical diagnosis or their familial risk. The presence of psychosis tells us that this patient is more likely to face a difficult clinical course. And this renews interest and generates awareness for clinicians on recognizing the role of psychosis, regardless of the other features in a patient, in terms of signifying risk for an adverse clinical outcome.